Hi everybody and welcome. I'm Karen Ramos and this is DEA 126 Infection Control. And this is a hybrid course, so for those of you who may be unfamiliar with what a hybrid course is, it's basically combining traditional face-to-face learning with online learning, and it offers a very unique experience to you as a student. In terms of something you could relate it to, it would be very similar to the online component being you having the patient chart. You are looking over the patient's medical history, dental history, possibly medications the patient may be taking. You are looking over your schedule and trying to get a sense for what brings a patient into your office on this particular day. If it's a patient of record, you're going to also be doing some research on your own. And you're going to be looking at previous patient notes just to try to get a sense for who your patient is, previous treatment that had been done in your office, maybe treatment that they still have remaining. And what this does is it helps you kind of put everything together and allows you to start formulating questions to ask of your patient. So the online portion of this particular class is going to be very similar. You're going to be given information, you're going to be given resources and tools. You are then going to be taking that information and doing some research on your own to try to find out some of the answers. And you're then going to take all of that information that was given to you and that you put in to finding the answers, and you're then going to apply it. And that's where the face-to-face portion comes in. In this case, you're getting the information that you have, and you have it prior to walking into the room, so you already have a sense for what your patient is there for. And you are then talking with the patient. You then have the correct and appropriate questions to ask your patient based off of the information that you had previously. You might be looking in the patient's mouth, and you might also be taking an x-ray just to try to gather as much information as you possibly can. So it's going to be very similar. You're going to be applying the information that was given to you in the online portion, and you will then be applying it in your face-to-face session in an actual clinical setting. So this particular class, as you can tell from the title, is focusing on infection control. And I have up 2 attention-grabbing headlines. Unfortunately, they are attention-grabbing for the wrong reasons. These are definitely things that we want to avoid, and this class is really going to focus on to ensure that you are not going to be in this particular situation. We do not want this to happen at all. So what this class is going to do is it's going to provide you with information regarding microbiology, its role in disease transmission, and also infections, things that you can do to protect yourself and also your patients through the use of sterilization procedures and also aseptic techniques that you're going to be applying in your own offices. It's also going to provide you with information on the hazardous communication standards and everything that you need to know in order to avoid these types of infection control breaches from happening in your office. Infection control is one of the most important things that you will be doing in your offices as a dental assistant, and more than likely you are going to be the one tasked to ensure that your office is in compliance with infection control when it comes to guidelines and recommendations made from the CDC and also from the ADA. And those are 2 organizations that you will learn a lot about in this particular class. So I hope that you're excited to kind of get in and kind of get a sense for, what dental assisting is all about. And one of the most important things that you will be asked to do in your office when it comes to ensuring that you are being safe and also that you are keeping your patients safe as well. So I look forward to seeing all of you in class, and thank you so much.